Hey folks, I'm Ryan and welcome back to the Reading Room. This week we're going to be taking a look at one of my favorite recent cases. This is a Chihuahua who's presenting for coughing and a heart murmur. Overall, our signalman is an 11-year-old male castrated Chihuahua who's again presenting for that coughing and a murmur. Of course, radiographs were part of our baseline diagnostics in this patient. So let's take a look at this left lateral projection to start with. Take a look and see what your findings are. For me, the biggest things that I'm noticing, of course, is the heart. Jumps right out at you. This heart is too big. It's too tall and it's too wide. When I look at where the heart is big specifically, what I'm noticing is that the caudal margin is both rounded and flattened. This is evidence of left atrial enlargement. Additionally, there's some enlargement of some of the pulmonary veins. This is best seen in the cranial lobar vein here, which is a little bit enlarged and tortuous. The other thing I'm noticing about the cardiac silhouette is this rounded cranial margin right here, which is a little bit unusual. Typically, patients with left-sided cardiomegaly have just a change at the caudodorsal margin. So this is something I'm paying extra attention to try to decide what I think this is, and we're going to come back to it in a second. When I know that a patient has cardiomegaly, the next step that I'm going to look for is what do the lungs look like. And in this instance, there is a little bit of increased opacity in the caudodorsal lungs, not so much in the cranioventral. And this is again something that I'm going to continue to evaluate in my orthogonal projection because I don't have enough information in this single projection alone. The last thing that I'm noticing as a major finding is that there's a little bit of narrowing of the caudal lobar bronchus in this projection, which could be an indication of why this patient is coughing. So let's take a look at that dorsoventral projection, and this corroborates a number of the findings that we saw in the lateral. We've got enlargement of our left atrium, which is this rounded increase in opacity here between the caudal lobar bronchi, and then we've got a little bit of auricular enlargement, which is at the 2 to 3 o'clock position of our cardiac silhouette over here. In terms of looking for evidence of right-sided cardiomegaly because of that rounded cranial margin of the heart, I'm not really seeing any evidence of it in this projection. This is a normal region of the right atrium, and I don't see any other evidence of other structures that could be there, like either the aorta or the main pulmonary artery. The aorta would live here between 12 and 1, and the main pulmonary artery here between 1 and 2. I don't see any focal enlargements of the cardiac silhouette there. We can corroborate some of our tortuous vasculature here in the caudal lung lobes, but then I'm not seeing any evidence of that interstitial pattern that we were questioning in the dorsal lungs in the lateral. We can see those vessels really nicely caudally, and so I think that was probably an artifact of summation in our lateral projections. So those are kind of my major findings for this patient, and let's review those all again. We've got severe cardiomegaly, mild venous distension and tortuosity, no evidence of congestive heart failure, so there's no cardiogenic pulmonary edema in this instance, and some compression of that left caudal lobar bronchus in our lateral projection. So I think probably that's the cause of cough in this patient. There's chondromalacia and compression by that severely enlarged left atrium. But I think the question that remains is there any evidence of right-sided cardiomegaly? We'll get to that in one second because I think this is a really nice illustrative example of something that we're noticing more and more and has recently been published in the literature. So our next steps for this patient are going to be an echocardiogram and ECG for our cardiac workup. We're going to start this patient on pimobendan because it has evidence of that left-sided cardiomegaly, but we're not going to start a diuretic at this time because there's no evidence of congestive heart failure. So when we look at the echocardiogram in this patient, there's a couple things that we can notice. And the big thing that is the take-home here is that the left side of the heart is big, but the right is not. So in the first image here to our left, we've got our left atrium here, our left ventricle here, and this is the level of the mitral valve. This mitral valve is abnormal. It's myxomatous degeneration. We've got a little bit of like kind of knobbly appearance to it. And so this is evidence of mitral valve degeneration. This is the cause of this enlarged left atrium because there's going to be regurgitation through that valve. This is the right atrium over here, which is quite a normal size, and the right ventricle there. When we look at it in this projection as well, we've got the left ventricle, the left atrium. Again, there's the level of that mitral valve. And then this here is the right atrium and the right ventricle. And what we can see here is that this left atrium and the associated veins are quite enlarged, and that's what's causing that focal enlargement of the cranial aspect of the cardiac silhouette in our patient. It's not the right atrium, it's all just a enormously enlarged left atrium in this dog. And so this is actually something that's been recently published. The authors of this paper looked at a number of patients with severe left-sided cardiomegaly and did conclude that there could be false identification of right-sided cardiomegaly in the presence of severe left-sided cardiomegaly. So this is something we need to be aware of and be mindful of, that we're not diagnosing this patient with both left and right-sided change. This is just left-sided cardiomegaly, and all of this is myxomatous mitral valve degeneration in this Chihuahua. So I hope that's been helpful. The next time you're seeing a coughing Chihuahua come into the clinic, which I'm sure is going to happen sometime soon.